Well, for a deeper dive into the cost and consequences of universal health coverage, I'm joined by Raymond Gilpin, Dean of Academic Affairs at the Africa Center for Strategic Studies. Welcome back to the show.
Thank you.
So, Raymond, as we heard there, the 2030 Sustainable Development Goal, we know that this is one of their plans. How realistic are those goals?
I think the goals are very aspirational. They are realistic to the extent that if they are funded, and if we have countries having strategies and plans in place, you could possibly see those happening. But I think the most important thing about the Sustainable Development Goals is that they provide a framework to understand health within the context of development writ large. I think that is one of the most important things and a useful step forward.
And speaking of steps forward, what other sort of progress have we seen? And also, what have been the main obstacles?
I think in terms of progress, we could see that in West Africa, for instance, the Ebola crisis was a wake-up call. Whereas over the preceding decade, there had been a lot of progress in addressing HIV, malaria, and tuberculosis. And some would argue at the expense of primary health care. And so when we had something like Ebola, which was basically a primary health care catastrophe, there was no capacity, institutions were weak, and the whole health ecosystem collapsed in spectacular fashion. And so many countries have started moving away from this project-based health delivery mechanism to a more system-wide mechanism. And we see countries like Ethiopia going from 11% coverage in 2006 to over 60% by 2011. That's a significant leap. And there are a number of other African countries who've made such progress.
Now, we know that we have now a new WHO Director General, the first from an African country, Ethiopia. What do you think he brings to the table as opposed to his predecessor?
I think he brings a different perspective. He was Minister of Finance, Minister of Health in Ethiopia when Ethiopia recorded this tremendous leap forward. I think he brings that experience, understanding that discrete projects do not the health system make. What we really need in Africa is a focus on strengthening capacity across the board, strengthening capability, that's capacity plus the agency to act, and making sure the institutions are robust. And there's two important gaps that he understands that I think bodes well for Africa within the new WHO context. The first is the financing gap. For many, many years in the past, we've seen this project-based financing, a focus on government financing. I think he can bring a more creative approach, having the private sector, non-governmental organizations, and also what some people call a contributory financing mechanism, which brings in a modicum of health insurance.
Now, speaking of that, we know that obviously the public versus private financing, when it comes to funding a lot of this coverage, it really tends to be a sticking point. Are there any good examples of countries that are striking the right balance?
Right now, what we see is a number of countries who are aspiring to strike the right balance. It's been very difficult because the gap has been really, really great, and countries have found it difficult to fund even the most basic needs. We see countries like Botswana taking a look at healthcare in a very with a very dispersed population. They had to fund over 800 mobile health clinics just to provide primary health care at the community level. And then you have the clinics and the hospitals. So there's a huge gap. But the interesting thing is that African countries are recognizing the fact that just depending on donor support and just on government funding alone would not take them where they need to go.
And we're certainly seeing some of the toll of that on systems, say, in the UK, in Europe, and then we also have the US really trying to tackle how to really provide not universal healthcare, but basically better coverage at lower premiums for people. So with that being said, how is Africa then managing the single-payer system?
Well, with most African countries are really at the really initial stages of this. If you ask the question about 5, 10 years, I'm sure we'll see a number of countries making significant progress. We've seen Kenya make a bit of headway in this regard by looking at public-private partnership financing mechanisms. We've seen Ethiopia itself finding ways to integrate the NGO and CBO communities in the financing side of things. And so getting African countries more bought into the single-payer system will take some time, because it's not just an issue of affordability, it's also an issue of accessibility. Households and communities might be able to afford it, but if they don't have access to it, if they are in remote areas or in underserved areas, it becomes really problematic.
So certainly a key. Access really is everything. Thank you so much. We'll have to leave it there. Raymond Gilpin, Dean of Academic Affairs at the Africa Center for Strategic Studies.
Thank you.